Hello, friends, and welcome back to another episode of the Juicebox Podcast.
Hi, my name is Ashley. I am the mom to Anna, who's diagnosed with type 1 at age 3. I'm excited to be on the podcast today.
If this is your first time listening to the Juicebox Podcast and you'd like to hear more, download Apple Podcasts or Spotify, really any audio app at all. Look for the Juicebox Podcast and follow or subscribe. We put out new content every day that you'll enjoy. Want to learn more about your diabetes management? Go to juiceboxpodcast.com up in the menu and look for Bold Beginnings, the Diabetes Pro Tip series, and much more. This podcast is full of collections and series of information that will help you to live better with insulin. Please don't forget that nothing you hear on the Juicebox Podcast should be considered advice, medical or otherwise. Always consult a physician before making any changes to your healthcare plan or becoming bold with insulin. A huge thanks to my longest sponsor, Omnipod. Check out the Omnipod 5 now with my link, omnipod.com/juicebox. You may be eligible for a free starter kit, a free Omnipod 5 starter kit at my link. Go check it out, omnipod.com/juicebox. Terms and conditions apply. Full terms and conditions can be found at omnipod.com/juicebox. This episode of the Juicebox Podcast is sponsored by the Dexcom G7, the same CGM that my daughter wears. Check it out now at dexcom.com/juicebox.
Hi, my name is Ashley. I am in Winnipeg, Manitoba, and I am the mom to Anna, who's diagnosed with type 1 at age 3, and also the mom to George. I'm excited to be on the podcast today.
Awesome. I'm excited to have you. Anna is how old now?
She is 8 now.
So 5 years ago.
Yes,
5
you bet.
Okay. And George is older, younger?
Younger, he just turned 3.
Oh, okay. Oh, look at that. It's a nice little age. Oh, George wasn't around when Anna was diagnosed.
No, yeah, it was just Anna. Anna was actually the first one in our family, not just our immediate family, but extended family, diagnosed with type 1. So it was a very big surprise.
Any other autoimmune in your family?
Well, it was interesting. After Anna got diagnosed with type 1, a month later, her cousin, second cousin, my cousin's kid, got diagnosed with type 1. And then a couple years later, another cousin got diagnosed with type 1. So it is interesting that something, the virus that was circulating around when she was 3 somehow also reacted to her cousin. We didn't actually see her cousin, but things go around, right? And so something about this now in this particular time, I think in our genetics versus before where there was no type 1. So yeah, but no other autoimmune that we know of. Yeah.
Okay. She's diagnosed, then a cousin, how long after?
Like 1 month later.
A month later.
Yeah.
But not people you see frequently or anything like that.
No. And actually, he was actually living not in Winnipeg at the time, but in Canada. And then a couple years later, another cousin.
So Anna's first, she's 3.
3, yeah.
Then the cousin's how old?
He was like 24, which is interesting.
Then the third one?
Like 10.
No, you guys must stay away from each other at the holidays now.
Yeah, no. It's just, it was interesting because then, and of course, the younger cousin that was diagnosed in Manitoba, as soon as we heard they were at the hospital, we were like texting them and, helping them out. Before that, there was no one in like our aunts, uncles, cousins, nobody with type 1.
This is like 2020, 2021?
Let's see, 5 years ago. Yeah, 2020. Yeah.
Okay. This is during COVID is what I'm asking.
Well, the diagnosis was before COVID fully hit, right? Because COVID hit this was 2019. That's right.
I guess.
Sorry, 2019, because she's turning 8 in October, or 9 in October. So it was before COVID hit, and then COVID hit, pretty early on in her diagnosis there in 2020. Mm-hmm.
Did she have anything you can recall, like Coxsackie or another virus? Did she get hit hard with, an illness, anything like that?
She had a really bad case of the croup, like toddlers get that kind of thing, that bad barking cough. So I think it was that. It was quite bad. She had it quite bad. And so much so that I remember, my dad got really sick. Like we all kind of got really sick. That was beginning of July or end of June. And then over the summer, she kind of seemed maybe like a little bit more tired, a little more cranky. And then in the fall, I started to notice like she was really constipated. The peeing lots didn't really trigger because she was like potty training and a toddler and you're like going to the washroom a million times no matter what. Yeah. So that didn't trigger. And she was in diapers. But then she started getting yeast infections and that was weird. So I went to the doctor. I was like, this is strange. And they were like, oh, just put, this cream on. And I was like, okay. And I was like constipated. And they're like, oh, eat more fruit. I'm like, she's eating a ton of fruit, but like it was never an issue for her. And then we went to the doctor again. And then she had her physical in October, turning 3. They still didn't pick it up. When I look back now on pictures, I can tell in her face. But technically she wasn't gaining weight, but she wasn't losing too much, I guess, for them to catch it. And then one day she was just like laying on the couch, looking so sick, but no fever. And I was just like, something's wrong. I don't know what it is. I have no idea, but like, I got to go. I got to see a different doctor because the doctor at that point, we had seen 3 different doctors, her regular one and 2 other ones. Yeah. And I was like, I don't know what's going on. So I took her to this clinic we have that's staffed by emergency ER doctors, but is kind of like an urgent care. Because I thought, I think they're going to know. At that point, I still didn't know like emergency, right? Because it wasn't like, it didn't seem.
Somebody had only told you that your 3-year-old had problems that 45-year-old women usually get.
Yes.
Have her eat more fruit and
yeah, and use some cream.
Yeah, use some cream.
So as soon as we go in and I say those same things, and the doctor looks me in the eye and is like, we're going to do a finger poke. They poke her finger. She's off the charts. Like the glucometer won't read her number. Mm-hmm. So she's like, okay, we're going to go to the Children's Hospital. We'll let you know that you're on your way. We'll call ahead. And I was just like, and her face was just very, very serious and calm that like, you need to go now. It'll be okay. So we rushed down and got diagnosed and all that. But yeah, like I tell actually like, and then we got a new family doctor after that because I was pretty upset that we had missed that and that it had to get so bad of her like laying on the couch lethargic to get diagnosed. So I talked, and her new doctor, when I told that story, I was like, okay, so to start out, I need to tell you the story of like her red flags that didn't appear because it wasn't peeing because she was in diapers. And he said, as soon as you would have said about infection, I would have immediately done a blood test, like done a finger poke. A1C, like that's not normal for a toddler. Yeah. And I was like, exactly.
It's funny. You said something that like everyone says, and it's the first time today that I wondered about it when they say you need to go to the hospital right now. Like, don't go home. Don't do this. Just go home. Like, It makes me think like how many people are told by a physician, you have to go to a hospital right now. And then they just don't go. Like, I wonder what that number is. You know what I mean? It's a common thread through everyone's story.
Yeah.
Doctor never doesn't say, don't pass go, don't collect $200, just get there. It's interesting. So, okay. So you have a doctor now you're happy with? You can manage diabetes confidently with the powerfully simple Dexcom G7. Dexcom.com/juicebox. The Dexcom G7 is the CGM that my daughter is wearing. The G7 is a simple CGM system that delivers real-time glucose numbers to your smartphone or smartwatch. The G7 is made for all types of diabetes, type 1 and type 2, but also people experiencing gestational diabetes. The Dexcom G7 can help you spend more time in range, which is proven to lower A1C. The more time you spend in range, the better and healthier you feel. And with the Dexcom Clarity app, you can track your glucose trends, and the app will also provide you with a projected A1C in as little as 2 weeks. If you're looking for clarity around your diabetes, you're looking for Dexcom. Dexcom.com/juicebox. When you use my link, you're supporting the podcast. Dexcom.com/juicebox. Head over there now. This episode is brought to you by Omnipod. Would you ever buy a car without test driving it first? That's a big risk to take on a pretty large investment. You wouldn't do that, right? So why would you do it when it comes to choosing an insulin pump? Most pumps come with a 4-year lock-in period through the DME channel, and you don't even get to try it first. But not Omnipod 5. Omnipod 5 is available exclusively through the pharmacy, which means it doesn't come with a typical 4-year DME lock-in period. Plus, you can get started with a free 30-day trial to be sure it's the right choice for you or your family. My daughter has been wearing an Omnipod every day for 17 years. Are you ready to give Omnipod 5 a try? Request your free starter kit today at my link, omnipod.com/juicebox. Terms and conditions apply. Eligibility may vary. Full terms and conditions can be found at omnipod.com/juicebox. Find my link in the show notes of this podcast player or at juiceboxpodcast.com.
Yes.
Okay.
Her doctor right now is excellent. And when I told that story, he was like, yeah. And he said he had actually recently diagnosed someone with type 1 just from their intro appointment over the phone based on things they said. And they were like, I think you need to get a blood test right away. And I was like, oh, that's so good. But I think there is a problem. And I'm still hearing stories of folks that it has to get so bad before you're diagnosed that like every primary care physician and walk-in doctor needs to it doesn't hurt to do a finger poke. And if it's not, then it's not. But
I
the
take
fact
your
that
point.
little kids sometimes have to get so bad before diagnosing, I don't know. I think there still is a lack of awareness among some doctors.
Yeah, I hear you. I also wonder, if the symptoms aren't enough to trigger in their head, hey, this could be diabetes, then I wonder, is it also unreasonable to expect that the symptoms would be enough for them to trigger the idea of finger poke? What if if finger poke was you hear this, and this, you definitely do a finger poke. How come if you do this, and this, you don't wonder diabetes? How do you get them to have that moment when they hear that information?
Or, the other way to go, and then what I've thought of actually is just at the yearly checkup when you're doing already your shots, they're already crying, you could just do a poke. That would cost pennies to do a poke. They're already crying. It's not fun. That would have caught my daughter 3 weeks before she was in DK because she saw her physical appointment 3 weeks, she turned 3 weeks before diagnosis. So if they had poked her finger just as a normal routine thing, that would have, she still was probably in DK, but it wouldn't have been as bad because the last week before diagnosis is when it got really bad.
I have to tell you, when my mom was in the hospital and they just stuck her finger, it cost $100 every time they did it. So I don't know if it's going to be.
Really?
Yeah, that's how they charge for it. It's the test strip and the nurse.
Really?
I swear to God, it was. Every time they checked her blood sugar, it was $100.
Well,
we have a different system than you do.
Okay. Well, in our system, I don't know, the cost to our taxpayer system when you get a shot is $7. So
Wow.
I think a finger poke would be less than that.
Nice.
Because there's no vaccine.
In Canada, I'm sure it would be. I was just saying here it wouldn't be as cheap as you think. Because people say all the time, how come they don't just do this? At every doctor's appointment and blah, blah, because the insurance probably won't let them. Even if the physicians wanted to do it, I don't imagine they'd be able to get it through the insurance, is my point. So,
right.
Yeah.
That's
Anyway,
fair.
so this all happens, is obviously out of the blue for you. And she's very little. You guys go to the hospital. How long are you there? What's the first weeks like?
We just had to stay the one night because their first day of training, we were so good. I guess we they thought we were okay enough to go home the second night, or I guess she wasn't so bad. So yeah, we had training all that week. So it was Monday. So was when it happened, when took her in, and then training Tuesday, Wednesday, Thursday. Actually, it was 3 days of training. And then Friday was Halloween. The poor kid. But she was still pretty sick. So she handed out candy. And I don't know, we dosed her something, but she was still kind of pretty tired and little. So didn't really know the situation. But yeah, so we had the training and that went pretty good. And the big thing that was a huge game changer for us was getting an insulin pump and continuous glucose monitor, which at the time we did have a program for kids only in Manitoba, but we didn't have CGM coverage. But we have private insurance, but that didn't cover CGM because it wasn't under, it's called the public umbrella of pharmacare, which public drugs are covered. It wasn't yet in Manitoba. So, but we kind of researched it. I listened to the Juicebox podcast. I was listening to all this. And I was like, okay, we got to get a CGM. This is really scary. We don't know what she is. And we need to get a pump, as soon as possible. So talked to them and tried the Libre first. And then we switched to the Dexcom and just loved it. And it was a huge game changer for our control and nighttime. And
when you say it's not covered, It's covered for children, but not for adults at that time. I know this is 5 years ago, but
it has changed. At the time, insulin pumps were covered for 18 and under. CGMs were not at all for any age at that time. So we paid out of pocket.
All right, you had to pay for it yourself. Right.
Yeah, which we were able to. But then seeing like the difference in that, I, along with Trevor and Ken and Liz, a group of us, we decided during COVID times that it was like December 2020, like, this isn't right. Like, we need to change the coverage here in Manitoba, especially during COVID times when there's, pandemic and dangerous health situations and more people are getting diagnosed. We need to have coverage. So we started a large campaign, and I'm super excited to say just recently, as of today, April 15th, we now in Manitoba have another pillar of our campaign, which is free insulin now for anyone with type 1 or type 2 that uses insulin.
Really?
Free insulin in Manitoba, no deductible.
How'd you get that done?
As of today. And we have other stuff too. We have all ages insulin pumps for everyone and CGM for everyone. But the third pillar, we had 4 pillars back in 2020, and the third pillar, insulin, came true today. And the last pillar is insulin support in schools. So we we drafted like this manifesto almost of these 4 things that we wanted.
Actually, let's not call it a manifesto. Okay.
Okay.
Yeah.
Sorry. You're right. Can you take that out?
No, it's just funny. That's all. Trevor's been on the podcast, right?
Yes.
Yeah. Like years ago.
Yes.
And then at that time, it was about access to CGMs.
Yes.
I see. How did you all know each other?
So we met. We have this Facebook group, Manitoba Families for Type 1. Any Manitobans listening not on the Facebook group, you should come join our Facebook group.
I would love it if you would have said you met because you're penguin farmers, but it's fine that you said it like that. What's the Facebook group called again? I'm sorry. Uh-oh, she's gone. This is it. Ashley, you're back.
Sorry.
What happened? You okay?
I'm okay. Sorry, I just hit a button by accident.
Oh, I thought you got mad about the penguin joke. Sorry.
No, the penguin joke was funny.
No, it wasn't.
There aren't any penguins in southern Manitoba, though.
There's no
polar bears. Polar bears are in northern Manitoba, which is quite far away from us.
Can I tell you a secret? There's no penguins in Canada at all.
Well, that's true.
It's not where they live. But
some zoos, but yeah.
Look at you being very specific. All right, well, fine. Then penguins live everywhere where there are zoos. I'm saying, I guess, where do they come from? I don't want to say right now because I don't want to show off that I know. So you guys all meet each other. Your was very telling. You're like, you don't know where penguins come from, idiot. So you guys all find each other on a Facebook group and you realize, or I guess you're talking and you're like, well, this is crazy that we can't get CGMs for the kids or something like that. How does that go from like a bunch of people online just complaining to each other or wishing out loud into actual action? Like, how does that happen?
Yeah, it's a good question. Like, people were kind of like saying, like, there were certain threads that kept coming up all the time, and it was no glucose monitor coverage, private or public, no insulin pumps for over 18, no insulin support in schools, and the cost of insulin. So like that kind of, those threads would come up, and Trevor and I were chatting because Anna was diagnosed, and he was someone that would help folks kind of in the group. And now I've kind of become that person too. Like if someone's asking a question, they'll like private message and say, hey, do you want some help? Do you want some information? And I was chatting with him about CGM and pumps, different things, and saying, yeah, I want to get Anna a pump and all that. And then it just kind of morphed into like, oh man, like there's no coverage. And, you know, our family, like I'm a teacher. And well, actually, that's not a guarantee that you make a decent salary. I know in the States it's a lot harder, but in Canada, actually, we do make a decent salary here. And so I said, you know, we can pay out of pocket, but even us, like this should be covered under insurance, like if for everybody, because it's going to save money to avoid emergency rooms, like short term and long term. It'll save the system money, right? So
actually, tell me too, it's one of those situations where in different provinces, there's different rules. So you live where you live and it's not covered at the time, but it's very possible somebody else lived somewhere else and it was covered.
Yeah. So some provinces at that time did, a lot didn't still at that time. So it's kind of been, and there were organizations, like larger organizations like Diabetes Canada, JDRF, now Breakthrough Type 1, like working on some of that. But during COVID, things like really shut down for advocacy because there weren't those lobby days and there weren't meetings with politicians. And so we kind of saw an opportunity as a grassroots group to really make some inroads with policy, just trying to we had time on our hands.
Right.
Like we kind of, you can't do anything, you can't see friends. And so we're like, let's take this on. And we talked to someone at JDRF and we had that, and Trevor came up. Well, actually it was my mom. I need to give a shout out to my mom, Ruth, who came up with the idea for the finger prick challenge. She's like, maybe if you can get the politicians to prick their finger and see how hard it is and how ineffective it would be, maybe, that might get them to really change their mind / get media attention.
Okay.
And then Trevor was like, yeah, that sounds awesome. And Liz, and then we kind of figured it out. And so we gave these kits to the politicians and they did that. And we got tons of media. And then we had these demonstrations at the ledge during COVID time. So it was all you could have maybe 10 people at some times or 15 people spaced apart with masks outside. And there wasn't much going on, right, for lobbying. None of the big organizations, not diabetes, just anybody. Nobody was lobbying at the ledge, having rallies and stuff. And so we would call ahead and be like, okay, so what's the limit? And they'd be 10 people spaced apart, 20, whatever it was at the time. And so we did one was Antiques Roadshow, where we had different antiques showing that finger poking was antique. Mm-hmm. And so kind of visuals. And we had one time we did an amazing race. We had the politicians go through different events, and everyone was game to do it because there were no events going on.
They were bored too. they were like,
yeah. So they were we had the leader of opposition. We had tons of elected leaders come out and chat with us and see all that. And then did lots of virtual meetings. The big thing, getting folks' attention was people in it's called a constituency, but where you live, their elected representative, having people from there ask for a meeting. So we targeted all the different areas, put a lot of pressure with the opposition to pressure, just media. There was a lot of layers trying to educate why it was important, why we needed to have it. At the time we had a government that was an austerity government. The conservative, which would be the Republican Party down there, that was not adding anything to the budget. But we had such a concerted push from the opposition and working with government that we got it. The first one was 25 and under for CGM and pump. That was the first kind of benchmark, which was 4 years ago. And then I think it was 2 years ago, then we got the all ages for pump and CGM. So we kind of pushed. And it was a huge, huge thing. No one was getting anything at that time. No group was coming away with a win at the time. And
it's awesome.
Because, so it was super, super good and huge. And now, I'm so heartwarmed. I heard a few weeks ago from a senior that was 65 and recently diagnosed with type 1, and she had no idea about the campaign, and because she just got diagnosed. Sure. And she's she has an insulin pump now, and she's I'm fixed.
She's gone again. You're gone. You're not there. You're talking to yourself. Muted. Hello. 65-year-old, just diagnosed. Oh, she's gone. She hung up on herself. It's awesome. I should leave this in. Rob, we might leave this in. Depends on how fast she comes back. The austerity party. There's no way most of us understood what she was saying there. Also, where's the ledge? Is that the train station on Yellowstone where they throw the dead bodies? What do you think that is? I should ask about that. Ashley, a polar bear got her. Yeah, she's dead. That's a shame. It's so cold up there. Probably the cold. Then she fell over. Immediately, the penguins drug her outside, where the polar bears ripped her apart limb from limb, which is a shame because look at all the people she helped with CGMs and other stuff like that. But now, a senseless death out in the wilderness. It's not fair. When you're breaching new lands and you're spreading humanity across the tundra of Canada, this stuff happens. It's not polite, but nature never is. You understand what I'm saying? My God, she's really been gone for a while. I can't keep talking like that. She really could be dead. This would be such a shame. Can I call this one polar bear attack? Imagine if she never comes back and there's no updates. What if she left her family in the middle of this? She's like, this is a great opportunity for me to just get out of here. Oh, she's back. Hold on a second. Ashley.
I'm so sorry. I kept talking and I guess I hung up on you.
You hung up on me a while ago.
I'm so sorry. I kept talking for a long time. Where did I leave off?
First, I'll tell you where you left off, but don't worry because I filled the time nicely with a tale of you trying to conquer the tundra of Canada, but eventually the cold got to you and you were killed. Sadly, of course, because nature is unforgiving. Then the penguins drug you outside where the polar bears ripped you apart limb from limb, which we spent some time going over how sad that was because you helped all those people with the CGMs and everything else. So that's what we did while you were. It's like a children's story that you wouldn't read to children. You were talking about the 65-year-old lady who was diagnosed, didn't know about anything, and now you found out she has a CGM, which I'm assuming made you feel like, wow, look at all the work we did. This lady's benefiting years down the road.
Yeah, CGM and a pump with no waiting periods. So the pumps, the other big thing was they used to have to jump through hoops. That was one of our demonstrations too. All the hoops you have to jump through to get an insulin pump before the kid program. You had to have it at least a year. You had to have an A1C under 10. You had to have all this stuff. So now there's no criteria. It's just type 1. You want to get a pump and, you've talked to your doctor about it and all that.
Awesome. So, do you think you actually talked them into understanding why this was necessary? Or do you think you bugged them to the point where they were like, why don't we just give them this so they stop coming here?
We did work a lot of education on it. And then, on their side, they would have pulled up research and stuff. And we had some research too that we showed, but they would have done on the civil service side, their own, research. But part of it was education. One of our big things that I would recommend to people in any country, if they have a committee meeting of their session, something on healthcare, we loaded up a speakers list of 12 speakers. So committees is talking about a law that's going to pass. Now, the law wasn't about CGM and pump. It was about something else. But they were nice enough to just, let us talk about what we were talking about under the umbrella of healthcare.
Yeah.
And in that, we were able to educate the committee members, which included folks that were, on the financial kind of team of the government and opposition people. We were able to do a lot of education. So that was really good. And we just met with so many people and just over and over. And
it was your finding that once they understood the situation, they were like, oh yeah, we don't do that. That's crazy. We should do that. It wasn't being kept from you as much as it was that nobody knew that you wanted it. Is that fair?
I think so. And that they didn't realize how important it was. And I think type 1, folks and parents are often, they have lots on their plate and it's hard to advocate. And we do have organizations that do that, but it's not the grassroots people saying we've avoided going to the hospital because it will alarm a severe low. And they can tell those stories, which are really impactful. And then people are like, oh, wow, this tech, and with a pump that it can work together with the CGM and all the good things that come from that. Kids can do better at school. They can be in a range for learning and so all of that. And so it all kind of fits together. And then that led to our latest campaign, which we have not achieved yet. We are right in the midst of it, though. We now have a committee of health and education meeting together. And I really, really hope that by the time this is aired, that we have insulin support in schools for daycare and young children, for little kids that can't self-administer. Right now, we don't. So a lot of folks, even though we have free pumps, can't get one because you don't have any help at schools or daycares for little kids.
It took me a long time of interviewing Canadians to realize that why is there so much regular and NPH being used in Canada? It's because there's no nurses at the schools.
That's right.
Yeah, of all the odd decisions. Because there are plenty of schools here that there aren't nurses at and people still, they find a way to handle it, right? There's schools in America where the secretary helps you with your insulin or, whatever. Somebody in the, a delegate or an advocate in the school who's willing to help, makes it known to the school. I'll help the kids with the stuff. And then, you get somebody to do it. But what a strange backwards way of doing something. Do you know what I mean? Seriously, you're using insulin that is, generally speaking, not used anymore. Unless you're maybe really low carb and you're using it for background. But there's so many insulins that have been invented since then that work, arguably much, much better. And yet in Canada, they're just oh no, it's 2025. Here's regular and MPH for your newly diagnosed 5-year-old. because, some of the months of the year while your kid's at school, like who's going to give them the insulin?
Mm-hmm.
Is that not frustrating once you realize that's why it's happening?
Yes,
Yeah.
it's extremely frustrating. And I was able, so I was a 5-minute drive from her daycare when she was little, and her school isn't too bad, 8 minutes. So I was able to drive. And then, so as I'm driving and doing the lunchtime hustle, you run over, run back. I'm in a position that I'm not a classroom teacher. I'm in resource counseling. So I have the flexibility. My employer is flexible. But I'm like, this is not fair that we have to
use 50-year-old
inequity.
It's just a strange thing. It would be like if, I don't know what it would be like. It would be like if somebody told you oh, you're not feeling well. Well, we're going to put some leeches on you. And you're like, well, why can't we do the testing? And you're like, oh, there's no nurses at the testing center. Could you put some there? Why are we still reaching back to such an old idea? It just smells of exactly what you talked about. It's just that nobody was looking at it. So it's well, this is how we do it. So we just keep doing it this way. Oddly enough, it's not some big organization that gets through to people. It's a handful of people who met online. Really awesome, it's a great story.
Yeah. And the organizations, their focus, they haven't really taken on insulin support in schools until recently. I would say Diabetes Canada. I'll give a shout out to Joan Keane if she's listening, the advocacy director,
she's gone. This is my favorite part of the show so far. I mean, she's awesome, but the part where she hangs up on herself, because you imagine right now she's talking about Joan from Diabetes Canada and all the hard work she put into it, everything. And it's such an interesting, so let me go over it. First, they got the CGMs for the kids, and then, they got that expanded to older and older people, CGMs and pumps. If your doctor says you deserve it, there's no arguing, you just get it. Then we haven't even gotten to the free insulin thing. I'm trying to figure out what that's about. Now she's trying to make sure there's support in the schools so the kids can use their insulin pumps at schools. There's really wonderful work being done. And in a short time, too. 5 years to get all this accomplished is pretty astonishing, actually. Do you think she's still right now talking to herself? She could be. I feel bad about that, I want to say. And when you're listening back, Ashley, because we absolutely are keeping this in, I do feel badly right now. Oh, here she is. Here we go.
I'm so sorry. I think my cheek is hitting it. I'm so sorry.
You shouldn't apologize. I have the greatest I actually just did a whole recap of everything you guys have done so far, waiting for you to come back. Tell me a little bit about that. Good. Keep going.
So the insulin support in schools, right now, some provinces, which are states, do offer it with support staff trained by nurses. Mm-hmm. And one province does have nurses, but then they have a shortage of nurses, which creates a problem. So we're looking at the model of support staff trained by nurses here. And now we're in kind of the committee with health and education. We just had a meeting, but it is tricky because the easier thing is to just leave it the same. That's easier because schools are oh, insulin, they're scared of it or whatever.
Yeah. Or whatever. They don't want to do it, but go ahead.
They don't want to do it.
Yeah.
But we have CGM now. And so it kind of had to all be in order. We had to get CGM coverage so everyone can have a CGM. So if you're on social assistance, you don't make any money right now, you get CGM. And if you're low income, you're going to meet your deductible, your public deductible with your insulin and, well, I guess not insulin anymore, but your other supplies. So the point is all the little kiddos have CGMs now, one way or another.
Right.
And so now we have that safety net in place that people aren't finger poking. So the risk, with the pumps, you can set the max bolus, really low to, you can set that low to keep it folks safe. So, and there's lots of, you can do a double check. There's lots of things you can do to keep everyone safe. But the risk of having kids on outdated insulin and not having with looping automated insulin devices, we can't, that risk is higher than having the pumps now. And we all know that, but I think it's just kind of trickling down now. Yeah.
Yeah. I don't understand how people's minds work. You're saying, hey, we're treating these children as if it was 50 years ago, maybe longer. Very detrimental to their health and to their happiness and their day-to-day living and et cetera and so on. And by the way, here's a bunch of examples of people who grew up 50 years ago and, some of the complications they have now. And they go, well, what if someone miscounts the insulin? Wow, that's the leap you made? Awesome. Just way to miss the forest for the trees or the ice for the snow.
Yeah.
Earlier you just kind of blasé were hey, insulin's free now. How did that happen?
So that one actually was a huge or systemic one. That one I can't our committee wasn't responsible for that one. But we did put it forward, so which is awesome. So the whole federal government, so like, you would have, your president, your Congress, Senate. So our federal government made a deal now with Manitoba it's called pharmacare with no deductible. So for contraception and diabetes medication. And for diabetes, so far they're including insulin, Bisquami, the nasal glucagon, and type 2 metformin type stuff. So they will all be free as of today with no deductible, which is amazing. And why did they pick diabetes medication and contraception? Like it's kind of interesting two things to start, but for sure for diabetes, I think the national campaigns around the importance of diabetes medication in our system and all that. And we were hoping to see pump supplies and CGM in that like free with no deductible. And we're not sure where that's going to end up because there was talk about that. Mm-hmm. And then when we actually saw the document, it wasn't in there. So we'll see. Like it can be built on though, right? It's a stepping stone. Like
yeah, that's a big deal.
It's a big deal. It's a huge stepping stone. We do have an election going on right now though. At the end of month of April, we might have a different government. And they have said so our current federal government is the Liberals, which would be more like your Democrats, and if the Conservatives win, they had said they were going to get rid of pharmacare, like get rid of this drug program because it's not in their philosophy. But there has been a lot of pressure on them. So we'll see what they actually do. Hopefully the pressure is enough that even if they won, they wouldn't get rid of it, but they want to do more tax cuts, right?
This could just flip right back again.
It could. Yeah. It's at the whim of government. But saying that, when something becomes so entrenched, like it's free in Canada to go to the doctor, it's free to go to the hospital, even a conservative government, that's pretty hard to take that away.
Take it away, yeah.
Once it becomes very entrenched and that people would, if you're not going to get elected because of that, then they wouldn't take it away. So it just, yeah.
I would imagine you pander to your base while you're running, like, hey, we'll get rid of that pharma thing. Don't you worry. Put us back in charge and we'll get rid of that for you. And then you get there and you go, oh, we forgot to do that. And then it's probably good politics while you're running for office, not good politics once you're in office, I would imagine.
Yeah, exactly. So hopefully, and then that's up to the organizations and the grassroots people to say, like, don't, get rid of this. This is really good. Yeah. But the tricky thing is, like, it only is starting today and the election's at the end of the month, right? So that is tricky.
Are you recording today just by happenstance and it's starting today?
Yeah. Crazy. I actually didn't even know that when they had said it would start in June. And then I just found out yesterday, actually. I was reading the bulletins from the government because I like stuff like that. And then I was like, April 15th. Okay, that's today.
That's awesome. You're like a little door casher. You love stuff like that? Is that what you're saying?
I love politics and the news and all of this, which is probably why I enjoyed doing the campaign so much. And no, I love all this stuff. So it's important to kind of keep informed of what's going on. But I do find it frustrating sometimes when folks didn't want to help out. But I do understand type 1 folks and type parents with kids always have so much on their plate that it is hard to kind of take up extra.
Well, listen, it's a good example of politics it follows the whims of the people who are paying attention to it. So you pushed, you got what you wanted. If somebody else would have stepped up with the thing they cared about, they might have their thing now,
Yeah, for sure.
Yeah, that's just how it works.
For sure.
Yeah, speak up.
I think so. Yeah, for sure.
It's awesome. So how is your daughter doing? Now she's got her pump and she's got her CGM and it's 5 years later. How's her diabetes going?
Good. Yeah, she's a trooper. She's super active. She is involved in tons of stuff. She's in dance and Girl Guides and she loves going upside down on the monkey bars and she's very, very active child. And swimming, she's able to swim her laps to go on the deep end. And yeah, she's always been super active. And that's what's been great about the Omnipod, and the tubeless has been so, so good for that. And the Dexcom. So I can't say enough about how great her pump and CGM has been for her management and also just for her to be a kid and just be able.
Do you have to go to school every day to give her insulin?
So I was, yeah. Well, we would split it up with our family. So there was different helper people, grandparents, someone from the team was going every day. Now that she's 8, she can, we can FaceTime her with her food. We're lucky that she's old enough to do that now. So, but we're up until last year for sure every day. Yeah, wow. Someone from the team.
But you got to a point where you said, like, she can do this. Like, if we're talking to her, she can push the buttons, make this work. And
yeah, for sure. And the maturity level, it depends on the kid. You know, there's no set age. And then, you know, I have a friend that her kid has Down syndrome. And so, you know, then it's not an age, it's that, right? So we, definitely need to have folks at the school trained to support kiddos.
I mean, isn't it odd, seriously, that you can't just, like, that it's that hard to get something set up? Like, somebody just can't agree, like, oh, I could text you at lunchtime and push these buttons for me. Mm-hmm. And that the person in the room couldn't handle it. I know nobody wants, but is liability really the reason there? Like, because here, I think it's liability. Nobody wants to be liable for anything, but is it the same in Canada?
Yeah, I think like it's just been left out. Like, because we do right now, kids get medication from schools if the doctor signs off on other medication, including, you know, seizure medication, feeding tubes, you know, like there is lots of medication. Well, not lots, you know, medication is being delivered in schools already with the training of the nurse. Just, you know, insulin's always been left out of it. And I think it's just hasn't been explained or advocated to the Department of Health, like that's not right for kid. Yeah.
Yeah. So like, it's interesting. I mean, you just mentioned feeding tubes. So like feeding tubes, other medication, oral medication, blah, blah, blah. There's all these different things. And then you come up and you're like, well, can you push this button so they can have the medication? Go, oh, no, that's not possible. Mm-hmm. And does anybody then ask why? Like, what makes this different than that? Did you ever get any feeling for what the reasoning is? You just feel like, because you keep saying like, well, they didn't know, but like, how much do you really need to know? You're giving that kid its meds and this kid is meds and that kid are meds and my kid can't have their meds because why? I don't see any common sense at all. Do you?
Yeah, no, I agree. Yeah, I totally agree. I think it was risk averse and the school, like the Department of the Health is who does the guidelines with schools. And so there is maybe some hesitancy there, but there is risk already. Like anytime you have a type 1 kid at school, there's risk. And if they're on MPH, there's a large risk that they're going to go low because, you know, it's unpredictable insulin. And if they don't quite eat their exact carbs, they could shoot low and greater risk of them running high all day. And yeah, I've had parents say like, the schools are saying like, oh man, like your kid's acting out and not able to learn. And I think it's because they're high. Like some of the schools have like figured it out.
Yeah.
Like they're like, this is a problem. And also what happens a lot of times, people will put kids in schools near where they work. So then they can't be with their neighborhood kids. Like I have a friend, their kid goes to school like half an hour away from where they live because that's where their parent works.
Yeah.
You know, there's all these arrangements happening that it's just wild that people are having to change their lives, you know, work different hours, work part-time, just to like, so their kid can have proper health care. It doesn't make sense.
Yeah, I think the next time your Facebook group gets together and decides to fix something, you might want to teach people how to do critical thinking. It might be awesome. I think that might fix a lot more problems. It's just very interesting. It's such a simple idea. And to watch it, like watch somebody in there just go, oh, I can't do that. Like, you know what I mean? Like, I can't push the button. I don't want to be involved. Or like, I don't know enough about it. Like, you know about a feeding tube? Somebody taught you that too. You know what I mean? Like, I don't know. Also, like, if you want to be an educator, you're a teacher, right?
Yeah.
Like if you want to be an educator, like, doesn't that come along with the fact that some kids have things they need during the day? Like, how do you just go, oh, no, sorry, we don't want to be involved? It's a weird thing to say. You know what I mean? It's like if I said to you, like, you have a farm and horses on it. You go, yeah, but we don't pick the poop up. I don't want to be involved in that part of it. Like, well, that's too bad. You know what I'm saying? Am I making sense, Ashley?
Yeah.
Okay.
Yeah, no, for sure. For sure. Like being in schools, 100%, we learn about all kinds of kids with different medical needs, special needs. You know, we learn all the time about, you know, how we can support kiddos. Yeah.
Is there anything else being ignored besides diabetes?
Well, diabetes is the only healthcare thing that parents are responsible for in Manitoba. Mm-hmm.
That's awesome.
No other need, you know, asthma, like seizures. You can put seizure, you know, medication in someone's cheek, you know.
Yeah, that's all okay. Insulin? Yeah. No, sorry, can't be involved. I love how you're so Canadian, by the way. You're so like there's things you're mad about. And you just pause when you get mad. Do you know that about yourself? It's awesome. Like anytime you're like, I could go off on this, you just go, It's very nice of you. Very Canadian, I think. Have you apologized to anybody yet today? It's early still.
I did to you. I said, I'm so sorry
I know
that I hung up on you. I am sorry.
Could you say more like sorry when you say it, please? Next time. Thank you. Appreciate it. You're coming on the podcast today just to tell us about like all the things you guys have gotten accomplished and the things that are still on your plate, getting coverage at school. Once you get the coverage at school, you just hang them up. Like, are you done? The boxing gloves go over the mirror and you're finished? Or like you guys have other things you're thinking about?
Well, then we'll go, like we got free insulin. We want to go free, like pump supplies and continuous glucose monitors. It should all be free for folks of all ages. So that would be the next thing. But the benchmark of free insulin there, the next one should be easier. But in coming on and talking about all this, like it is like a rah-rah, but I also want to just kind of let folks know, talk to your representatives, like whether that's US, Canada, another country in the world, and like you can make a difference, even like a small group of people, and then getting other folks to join in. Like really having a concerted effort can make a difference. That people, if you keep going, like we've made actually really huge change in a short amount of time, relatively. Like everybody wants it right away, but if you keep chipping away at it, we can get better coverage, better healthcare for folks with diabetes. And I think it's a population that high needs, but if we keep everyone healthy now, like our future is bright. And so it would be amazing if we get better and better care for folks.
Yeah, unless you live in one of those countries where they disappear you for making noise, and then I would keep quiet.
Okay, well, that's true.
Yeah, but I'm hearing what you're saying. Like you got to get involved. Like it's very quiet frustration. It's not, I wouldn't call it big, but I've heard frustration from you a couple of times. Like you're like, I don't know. You apologize for them. You say, I know people whose kids have diabetes are busy. But what I'm hearing is, but we need more people to be involved in this if you really want to get something accomplished. Is that really the rest of that sentence?
Yeah, I think so. And I think like just there are folks probably, I know in Canada, there's different groups, different online groups and things. And there are people mobilizing for a variety of things for type 1 folks. And I think like the school issue in Canada is still a huge thing. We have 3 provinces that have support, but 7 that don't. So I would really encourage folks to like work together and try to mobilize in the provinces for that. Just with the technology getting better and better. Now Omnipod 5 has been approved by Health Canada.
Yeah, I saw.
Which is amazing. So we got that loop pump. And then we have, of course, the DIY loop and Medtronic and Tandem.
It's a big deal. For people who don't know the history of Canada, you guys are generally years behind everybody else getting stuff like that. Just having it available, let alone anybody paying for it or it being covered. Oh, she hung up on herself again. This is awesome. Do you think she's still talking? Let's not wonder about that again. What was I going to bring up to her just now? Oh, I remember. I'll hold that thought. Will she apologize as soon as she comes back on? Lay your bets. I feel like the longer she doesn't realize she's talking without me here, the bigger the sorry is when she comes back. I'm going to take this opportunity to put just a tiny bit of Vaseline on my lip, which I do while I'm talking so that my lips don't smack together. There. Professional secret. Is it weird that there's a giant tub of Vaseline on the desk? Sure. Hey, Ashley, welcome back.
Hi, Scott. I guess we're probably done.
Why do you feel like you're done? This is awesome.
I know. I was just going to say, I think I got cut off. Just the looping pumps are so amazing. The tech and little kids can benefit from those so much. You know, the really small insulin doses and not having to have needles and being able to snack. And I just saw, like with my daughter, how awesome, and that was even before there was a loop, but how awesome the pump was. And I just knew it's not right that so many kiddos can't access that. And at that point, it wasn't the cost. It was just, there's no one at school to help them. Right. And like, how sad is that? Like, it's not even a cost barrier. It's just, you know, there's so many folks out there having a hard life for no reason.
I'll make this other point for you because listen, everybody's not going to be, you with your energy to like, go organize and set up meetings and go out there and educate. Like everybody doesn't have those skills, right? Like I get that. But I do take your point though, that things would move quicker and better if more people put their voice behind it. It's just what it is. And you have to make a decision at some point. Like I've got diabetes, my kid has diabetes. Like these things are impacting me. I've got to make some space for this. Like, and I'll give you if you wanted to get me upset about something I'm not really upset about, but more frustrated, you'd say to me, Scott, tell me a little bit about a podcast with 20 million downloads and thousands of reviews and tens of thousands of people in a Facebook group saying, like, I listened to this series and like, look what happened. Like, I'm doing so much better in all this. And then someone comes along and says, just tell me what to do. I don't have time for this.
Yeah.
My favorite one is I don't listen to podcasts. Okay. Like, well, I don't know what to tell you. The guy who thought to give you the answers put it in a podcast. So like, you're telling me like, you can't just listen to 20 hours of a podcast to get the answers you need because you don't listen to podcasts? Like,
yeah.
You seem like a nice lady, Ashley, but so I feel bad saying this, but what the does that mean? If I said to you, Ashley, hey, there's a volcano coming. We have to drive away right now. And you said, I get car sick. like, I don't know. Like, I'm just like, yeah, well, today you're going to get car sick because we're going to get away from the volcano that's erupting. Like, it's a strange thing to me for somebody to come to you and say, I don't know what to do. I'm really struggling. I'm having a lot of problems. My health is deteriorating. I'm aware of all this. Can you help me? And I go, yes, I can. Here's a 16-part series. And, oh, it's in a podcast? Oh, I don't listen to podcasts. Like, what the I don't even know. That must be how it felt to you, I'm imagining, when you're like, we need a bunch of people to support this so we can make it happen. And everybody goes, we do need these things. It's not fair, blah, blah, blah. Can you come to the meeting? Oh, not on a Thursday. Sorry. Is that frustrating? Like, it's okay if you don't want to say, because you seem very nice. But did I outline it pretty well?
I always try to go to the positive. Like,
I know.
We were able to like draw in a lot of people in at different levels of engagement. And I would just go like, even at the lowest level of engagement, like if everyone that's listening now in Canada that doesn't have insulin support in school would right now ideally email and call, their Minister of Health in their province, that would actually make a huge, and like if everyone did that, in the next week, that would make a huge impact because they track how many people are calling, how many people are emailing, and then meetings and things like that can come out of that. But they need to know that it's an issue.
Yeah.
And it is hard that someone's right to health, needs to be an issue, but there are a lot of competing interests from so many things in the healthcare system and in the, in the world in general that we know there's a lot of competing interests.
You got to be in line early and you got to have your hand out and you got to be a squeaky wheel. Like, you know what I mean?
Yeah.
I mean, you're Canadian, so like a very polite squeaky wheel, but still like if they don't know where to look, they're not going to look at you. Like someone's not just going to wake up one day in power and go, you know what? I'm having this premonition that there are kids that are using old insulin because we don't have nurses in the schools. I'm going to get up today and fix that. Like that's never going to happen.
Yeah, that's right. Yeah.
You need people to walk out in the streets and bang on a pot in a pan and scream and yell for a little bit. So, you guys did that. You deserve a ton of credit. Like anybody who does work like this deserves a ton of credit. It's not, obviously there's time out of your own life. It's not easy. I'm sure there was expense involved. Getting people together to do anything is insane. Like, have you ever tried to like organize a softball game as an adult? Go ahead. Good luck. You know what I mean? Go ahead and get 18 people together on the same piece of dirt with their baseball gloves.
Yeah.
You can't accomplish it. So it's more work than like you're making it sound like it was easy, but I'm going to guess that a big chunk of the last 5 years of your life have been taken up with this. No?
Yeah, like more at the beginning, the COVID times for sure was like the big push. And the insulin, it's kind of been the last couple of years. So like we did a tiered thing. We didn't take it all at the same time. Mm-hmm. Like we chipped away on things. Having a strategy, like definitely like to guide you, like what do we want and to be clear on the ask, and then just trying to folks to jump on and meetings, with the elected people, like they do care what people want. They want to get elected again, and we proved even a party with the opposition, huge opposition support, which is the NDP party, pushed it forward, but the Conservative Party, which was a party of austerity, did do the financial for all ages pumps and CGM because of all the pressure, right? So it can, you can get success with any party if there's enough momentum behind it.
No, that's awesome. It's a great message.
Yeah.
In the end, like you ever heard somebody come on the show and say like, "Oh, I'm having terrible outcomes with my endo. I went to my endo and I said like, what do we make settings here?" And the endo goes, I don't know how to use that pump.
Yeah.
What's your whole job? Why don't you take 5 seconds and figure it out?
Yeah.
How many people a day do they say to like, I don't know how to use that pump? Mm-hmm. You can't go home. And then I've said it to doctors before, like, you couldn't go home tonight and figure that out. And he goes, oh, we work a lot. I'm like, well, work. how about 4 more hours today to save everybody all this trouble? Like, my point here is it's weird where people draw lines in their head.
Yeah.
You know, whether it's the people who you're looking to help or the politicians who get to decide if you have help or not, or the people at the school who are like, oh, no, I'll do a feeding tube, but I won't do this. I can't do glucagon, but I can do an EpiPen. Like, none of that makes any sense. Like, so, you know, and so how do you get it to make sense? Educating is a nice way of saying it. But in the end, you got to bang on people's heads till they do what you need them to do. Like, sometimes it just is what it is, right? And you're too nice to say that because you're from Manitoba. But like, I can say it because I lived in Philly and Jersey. So nobody expects me to be nice. Like, when I'm an asshole, everybody's just like, oh, it's fine. He's from the East Coast. I can get away with it. Anyway, everyone do your jobs. That was my point. Ashley, I had so much fun with you hanging up on yourself today. I really did enjoy this. I'm leaving all of it in. I've left directions to the editor already in audio. I'm like, don't take any of this out.
Oh, boy.
I just want to hear you like going in and out and coming back and saying I think it's really lovely. And I think it keeps the information paced well, too. So,
well, maybe you can put the commercials in the Hangups.
Oh, Rob, there you go. That's a great idea. That's a great idea. We could put an ad every time you hung up on yourself. It's awesome. And maybe more people could do that so that we can make the editing easier. Let's think about that. You're terrific. I remember having the same kind of upbeat, lovely conversation with Trevor. You guys are all very lucky you met each other and got together because you got a lot accomplished together. It's really awesome.
Yeah. And yeah, it's a team effort, 100%. And I also want to give, a quick shout out to Michaela and Christy, who are part of the Insulin in Schools support team. So the latest campaign, they're kind of my buds. Michaela's done an amazing job presenting to government. So yeah, shout out to them too. Awesome. They'll appreciate that.
Well, listen, while we're shouting people out, I want to thank Mike, who helped me get tires on Arden's car 2 weeks ago. Imagine if everybody just came on and started saying each other's names. Like, oh, I really want to have Patty. She helped me a lot.
Okay.
And everybody else is like, Patty, who the hell's Patty? Oh, the one thing I can't let you go before I ask, what the hell's the ledge?
Oh, sorry. The legislature is like our government house.
Oh, I had it. By the way, I thought it was like on Yellowstone where they throw the dead bodies over at the train station. Like, you were like, we all got together at the ledge. And I was like, oh, this seems like something very sinister. But
oh my goodness, you're right. I did not explain that. Okay, yeah. So like the House of Representatives, or like like a large historic place where the government meets.
Okay.
You're right.
I hope I didn't ruin the train station for anybody who hasn't watched Yellowstone yet. Nevertheless, like the way you said it, I was like, oh, I thought it was like a physical place. Like in my mind, you were like, I don't know. It was like Canada's version of, I don't know, Red Rock or something like that. Anyway, it's funny. What should we call this episode? I think we might call it Disconnected Canada because you hung up on yourself so many times.
Okay. But no, connected though. Connected because it was all about connection.
How about Reconnected Canada?
Okay, that's better.
Reconnecting Canada.
I like that. Yeah.
All right. That's awesome. I can't say Manitoba because people don't even think that's a real place.
No, you can say Canada. Yeah, that's fair.
All right, Ashley, hold on 1 second for me. A huge thanks to my longest sponsor, Omnipod. Check out the Omnipod 5 now with my link, omnipod.com/juicebox. You may be eligible for a free starter kit, a free Omnipod 5 starter kit at my link. Go check it out, omnipod.com/juicebox. Terms and conditions apply. Full terms and conditions can be found at omnipod.com/juicebox. Today's episode of the Juicebox Podcast is sponsored by the Dexcom G7, and the Dexcom G7 warms up in just 30 minutes. Check it out now at dexcom.com/juicebox. Thank you so much for listening. I'll be back very soon with another episode of the Juicebox Podcast. If you're not already subscribed or following the podcast in your favorite audio app like Spotify or Apple Podcasts, please do that now. Seriously, just to hit follow or subscribe will really help the show. If you go a little further in Apple Podcasts and set it up so that it downloads all new episodes, I'll be your best friend. And if you leave a 5-star review, I'll probably send you a Christmas card. Would you like a Christmas card? I created the Diabetes Variables series because I know that in type 1 diabetes management, the little things aren't that little, and they really add up. In this series, we'll break down everyday factors like stress, sleep, exercise, and those other variables that impact your day more than you might think. Jenny Smith and I are going to get straight to the point with practical advice that you can trust. So check out the Diabetes Variable series in your podcast player or at juiceboxpodcast.com. Hey, what's up, everybody? If you've noticed that the podcast sounds better and you're thinking like, how does that happen? What you're hearing is Rob at Wrong Way Recording doing his magic to these files. So if you want him to do his magic to you, wrongwayrecording.com. You got a podcast? You want somebody to edit it? You want Rob.